Morning, everyone. I know you're sick and tired of hearing of COVID-19. I'm sick and tired of talking about COVID-19. I wish they'd leave us alone. They're not going to leave us alone. This is too good an opportunity for Justin Trudeau to pass up. He's back at the cottage. He's back isolating at the cottage. Although I heard Doug Ford is making an announcement shortly. I heard like 4 minutes ago, somebody just tweeted out Doug Ford speaking. And they said he's with Christine Elliott. Do they live together? Follow your own rules. That was a positive option for success. Anyway, regardless, I'm sick of it. And I know that this is not necessarily Canadian politics, but it is eclipsing everything. Everything is COVID. And they're using COVID as the excuse for not doing whatever it is, whatever you're dissatisfied with. Oh man, we really wish we could. We really wish we could give you those documents, but COVID-19. We really wish we could have a Christmas tree lighting ceremony outside, but COVID-19. You're right, Cam Guthrie? Can't possibly do that. Forget our culture. It doesn't matter. Safety's more important. Right. I think it's absolute horse poop. Anyway, here's Justin Trudeau's tweet to get us started. He says, I'm going to sound repetitive here, but bear with me. It's important. We need to get this second wave under control. We can do that by reducing our contacts and staying home whenever possible, wearing our masks, washing our hands, keeping our distance, and using COVID alert app. Okay, I haven't seen any proof that any of these things actually does anything. We've done all these things for 8 months, and apparently we're in the biggest second wave ever. Oh my goodness, we need to get more tests. Because that's the only thing that's going to save us from this virus that has a 99% survival rate, apparently. Anyway, Justin carries on. If you haven't already downloaded the COVID Alert app, click here. If you ever test positive, put your one-time code into the app and then let others know that you've been exposed and should get tested. It'll help slow the spread of the virus. Yeah, I don't believe that it will. I don't believe that enough people will use it for it to have any meaningful impact. That's why I don't think the app will work, unless you mandate it. And even if you mandate it, I'm just going to disable all of that and not take my phone out. Forget you. Forget that. Forget it. I'm not being tracked all the time because you want me to feel safe because of your rules. I don't trust this government. And why hasn't anybody across the board said, hey, that Dominion software was used to select both the leader of the Conservatives and the leader of the Liberals. Should we maybe be looking into that? No. Instead, they all unanimously said, congratulations, Joe Biden. And we haven't heard anything about that since. I'm going to talk about Sidney Powell and all that stuff at the end of the show. But I just don't trust these guys to do anything about anything. Not at all. Not at all. Nothing. Here is now moving to the provincial level, who Doug Ford I don't trust either. Here it says, retailers urge Ontario government to reconsider COVID-19 lockdown. I think we're going to see civil disobedience. I think it's going to be bad press to have the police cracking down on businesses that are trying to survive. I would love to hear from you if you get a visit from a bylaw agent that closes down your business. Record it and let's have a talk on Speaking Moistly. Record it. I'll broadcast it. I'll put it on Canada Poly and on Speaking Moistly. The only way to deal with this is to put it out there and show people what's happening. Record what happens. Comply. Have your camera. Say yes sir, no sir, yes ma'am, no ma'am. Do whatever they tell you to do. Close the doors. Take the fine. Record every second. This is me holding my phone. It's not a Kermit the Frog Muppet. Record it. Record it, and we'll talk about it, please. I would love to have a flood of these. I will do a daily show if we get enough, and we will shame these people. But anyway, retailers urge Ontario government to reconsider COVID-19 lockdown. Ontario's move to limit non-essential retailers in Toronto and Peel region to curbside pickup only or delivery could kill off thousands of small stores that count on make or break Christmas sales to survive, retail industry associations say. Listen, if you've missed out on 2019 or 2020 up to this point and you've got Christmas and you've got stock and you want to move it, this is like a Hail Mary. Like maybe our business survives. Maybe we turn a little bit of a profit and have a Christmas ourselves too. It would be a Christmas to get all the stock moved, right? Like it would be great to sell out, right? So I think that saying, well, now we're locked down for 28 days before Christmas and, after that lockdown, what's the plan? Who's got any kind of pathway to normalcy? Like, after 28 days, you know what's going to happen? 75 people being in the ICU will trigger lockdowns because we can't handle it. Oh my goodness, the healthcare services are going to be overwhelmed. It's garbage. It's a lie. We had over 1,000 beds, 1,400 critical care beds, and now we can't have 150 people in the ICU across 400 hospitals in Ontario? Absolute garbage. They're lying or they're completely incompetent. If you had one job to return us back to normalcy and 8 months ago was your starting point, would you be any further ahead? I think I'd be further ahead with half their resources. These morons. I'm just so upset on behalf of the people who are being shut down. I can't believe it. Like, just live it. Live it. Live it. And the rules don't make sense. They're inconsistent. I heard somebody got removed from the Canadian Tire in the South End in Guelph because they weren't wearing a mask. There are clear exemptions in the Section 22 order. You are violating people's basic, the Ontario Human Rights Code. And that is not appropriate. It is very frustrating. Okay, back to this. The Retail Council of Canada, RCC, and the Canadian Federation of Independent Business, CFIB. I've been using the CFIB and the spokesperson, or the chair, I guess, his Twitter account to tell you guys about what's going on, are pressing Ontario Premier Doug Ford to soften the blow for businesses as a large chunk of Greater Toronto Area enters a COVID-19 lockdown just as holiday shopping season was supposed to begin. Missing out on sales in May was harmful. To miss out on Christmas is fatal, said Dan Kelly, head of the CFIB. He warned that independent stores would see their customers migrate online into places such as Walmart and Costco, which as grocery outlets are deemed essential and allowed to stay open with new 50% capacity limits. The decision will ruin decades of work and thousands of businesses. So Walmart, for the Christmas shopping season, has a 50% reduction in your capacity, ability to go in. So now, welcome to Christmas shopping. You get to go stand in line to wait to get in the store. Like, this is just ridiculous. How does this help? Yes, we want to keep you healthy. Stand in the cold longer. We'd love to keep you healthy. Oh, it's too cold? Well, you can't come in here because there's a virus. I mean, not ha-ha, but ha-ha, right? Ugh. Anyway, Mr. Kelly, whose organization counts 42,000 member businesses in Ontario, said he will unveil a compromise proposal on Monday that will allow 3 people and 3 staff in a store to give mom and pop operations some respite. Without any in-person shopping, he said many businesses will be lucky to see 10% of their regular sales and could be forced to close for good. Why 3 staff? Why not like a staff or 2 staff, 4 people, right? Like a ratio of this many, rather than a hard number. I don't know. And again, where's the proof that where's the proof that the community businesses, et cetera, are driving this, and the flights that are landing into Toronto daily are not, right? Honestly. Oh, you terrible Torontonians, you're not listening, and so we've got to lock you down, you not listeners, but we'll just land all these flights in Toronto from places that are have the virus or don't have the virus or whatever. We'll just land them. We'll just land them, and it's fine. But you guys need to suffer, you Toronto businesses. The RCC, which acts for large and small retailers, has been pushing for the government to allow shopping by appointment in non-essential stores. It intends to urge Ontario to reconsider the 28-day duration of the lockdown and allow some stores to reopen sooner, perhaps with capacity limits or health screening for customers. Why are we just accepting 28 days? Before it was 14 days to slow the spread, and now it's 28 days because we're not going to build capacity. We're not going to do anything except be quiet and do what you're told. We rule over you, is basically what we're being told. Where's the accountability? We've had months and we knew where the weak points were. We knew where the bottlenecks were. And instead we're saying the only option is to lock you down and destroy your businesses. We're really sorry. It really tugs on our heartstrings about this. But if your business survives, then I haven't done my job, says Doug Ford. Honestly, F that guy. Done with him. And I have been this is egregious. The evidence, and I'm going to get to the evidence. I'm just kind of ranting a little bit here, but it's frustrating, right? The evidence doesn't, here, I've got it right here. The evidence doesn't back this up at all. The only thing that backs this up are the number of cases. And even then it doesn't. The first wave had far fewer cases, far more deaths. The deaths are in the, 20, where is this? 2014 on the 22nd of November, 21 on the 21st, 8 on the 20th. The deaths are just not in line and not increasing, right? The hospitalizations, the ICU numbers, maybe those are increasing, but it is the job of the people who spend the billions of dollars, and I believe it's $63 billion, on healthcare to make sure that it is doing the job that it is supposed to do. We're well under capacity and well under the average for the last 5 years. And I'm going to show you some comparisons about that soon as well. I'll get back to this. I'll find out where I was too. Hold on. Yeah, so I don't get the duration. I don't get why 28 days and everybody's just fine with that. Nobody's questioning that. Before it was 14. Now you know more. What do you know? Tell us what you know that requires this 28 duration lockdown, and what happens after. And I asked that, and I never got back to it. But what does happen after? What's the pathway to a normal world where you can have surety that the government's not just going to randomly lock your business down again and bankrupt you? Why invest? Why take the risk? right? Perhaps capacity limits or health screenings for customers. Businesses are not health professionals. Health professionals can recommend health interventions, and you have the right in Canada to decline any health intervention for any reason. You don't have to explain it to your healthcare professional. So now we're turning businesses into healthcare professionals. Oh, please wear a mask coming into my business. Well, I'm not sick, and healthy people can't spread disease. So no, sorry about that. Back to this. Carl Littler, sorry if I got that wrong, RCC Senior VP, says his group and the CFIB have requested a meeting with the Premier this week. He says he understands the need for urgent measures to combat COVID-19, but argues that the risk of transmitting the disease while shopping is very low. Statistics from Peel Region, he says, blame retail settings for just a tiny fraction of cases, and he says the government's treatment of retail should be based on clear evidence. It's frustrating for us that the government's approach seemed to be, well, we'll take a shot at anything and hopefully achieve something, Mr. Littler said, calling the lockdown a blunt instrument. Despite rising COVID-19 infections and pleas from politicians for residents to stay home, malls in Toronto and neighboring Peel Region were jammed with last-minute shoppers over the weekend. As the 12:01 a.m. Monday start of Ontario's new measures loomed, some people fear crowds from lockdown areas will simply flood malls that remain open in York Region and Durham Region, even though the government is urging residents not to do this. Again, people are going to do what they're going to do. And if the people aren't seeing the overwhelmed hospitals, if the people aren't seeing death in the streets, if the people aren't seeing the pallid faces of people returning from funerals, then this isn't happening. This is a regular flu season. And I'm sorry, this is a regular flu season. The people who are dying would have died anyway of other things. And I'm going to show you that too. I'm going to show you that there's proof of that. Scroll down in the article. Mr. Ford has spoken repeatedly about how difficult the decision to restrict businesses was for him, but he said on Friday that urgent action was needed to get the virus under control and avoid overwhelming the strained hospitals. They're not strained, and they shouldn't be strained, and it's irresponsible that that's even in the conversation, right? Hospital and ICU cases. We're at 147 ICU cases. We're not even at the 150 mark. This is the 21st, I guess. Where is it? I don't know what the most up-to-date number is. 146 is the most up-to-date. 147 is the most up-to-date I can see. We're not even at that magic 150 mark. We're 3 away, and they're saying, oh, it's worse than it's ever been, right? Active and hospitalized cases. It's not. They're lying. They're just lying, and people are accepting it. I said the framework was just put in place in order to get businesses to stop demanding that the government prove that they're the ones driving the lockdowns. I hope that Dan Kelly and the people who are representing 40,000 businesses say, prove it, or we're going to recommend they stay open. And I hope they recommend they stay open. Ezra Levent says, not a single person in Newfoundland and Labrador, a province larger than Germany, but it's on lockdown because shut up. 3 new cases of COVID-19 have been confirmed in Newfoundland and Labrador. 2 of the cases are close contacts of previously identified cases. One is travel related. It was within the Atlantic bubble. There are 21 known active cases in the province. No one is currently in the hospital. Lockdown. I know people in Deer Lake. They're locked down. This isn't about a virus. It's not about the numbers. It doesn't matter. And it doesn't matter, right? I'm showing the numbers. I'm showing the stats, the Ontario stats. It doesn't matter. They don't care. They are getting their orders from somewhere else, and they're implementing them, and it doesn't matter. I'm talking with people, and I think, would it be worthwhile getting a think tank that publishes regularly documents that cite real statistics, etc.? I don't know. Would it be taken seriously? I don't know. It would be attacked. I don't know. I don't know what a good strategy to fight this is, but it's not about a virus. It doesn't matter how many people. They're not setting reasonable limits. Like if 300 people get in Newfoundland get the virus, then we'll talk about measures to combat things. Until then, it doesn't need to be talked about because that's a regular flu season. If hospitals meet this threshold, and then we'll do it. Then we'll talk about it, right? And we're not even hitting the regular flu season. Well, I'll show you that hospitals in the UK are below the 5-year average. And I'm extrapolating based on what I've seen from people who see reports of their overwhelmed hospitals and then rush out to the hospital to record it and find empty hospitals. And this is happening again across the West. It's happening in the United States. It's happening in the UK, United Kingdom, and it's happening in Canada. Okay, here's Brian Pallister. He says, the message is clear, Manitoba, stay home. It's absolutely critical that we follow new public health orders from the public health officer. Let's focus on the fundamentals. Oh man, don't you love these hashtags, these idiot politicians? It's very reminiscent of like the slogans that Marxism uses to push their narrative. Here is Pallister talking about how important it is that we listen, and people are not listening, and people will do what they're going to do, right? Unless they see people on a death card. You know that scene in Monty Python, bring out your dead, bam, right? And the people are bringing people out. But in more modern times, during a plague, you would hang a white cloth, and then if you had somebody that was dying or something like that, there was a signal for that, and people would come and you would see that. It would be talked about. People would be talking about it. This is not that. This is not that. Anyway, here's Manitoba.
To stay home, some Manitobans and unfortunately some retailers as well are going against the spirit of those rules, and thus they are creating a greater risk to public safety. That is why today we are here to discuss new and stricter measures, including limiting residential gatherings to your household only, with exceptions for essential services.
So, they're talking about, there's a full lockdown in Manitoba right now, but they're locking down people's houses. This is happening across the West. But here's Brian Pallister. He says, local businesses are our neighbors and friends. Let's support them and shop local this holiday season. After he shuts down the retailers, he said, some retailers aren't obeying our laws, so we're going to shut them all down. It's that kind of contradiction that makes it hard to take these people seriously. I don't take them seriously. Laurie Goldstein is saying, good idea. Ontario Premier Doug Ford enlists retired General Rick Hillier, former head of the Canadian Armed Forces, to oversee COVID-19 vaccine distribution in the province. Why would they need military oversight? Why would they need that? I don't like that. That's not great. This is interesting. So they won't release names of suspects in drug busts, drive-bys, human trafficking, etc. But out in St. Catharines, violators of COVID-19 bylaws will be named publicly, says Niagara Regional Council, right? The time for education is past. The time for education is done. You've been educated. Now it's time to publicly shame you. It's crazy. It's crazy what's happening. It's crazy. It is absolutely insane. Here is the global race for a coronavirus vaccine dose. How does Canada compare? Apparently, we've bought 10 doses per person, per capita per person. So with vaccines, and we're 40 million apparently now. So, 37.9 million. When I started, we were less than that, a lot less. Anyway, with vaccines for the novel coronavirus within reach, doubtful. Countries around the world are rushing to secure access to doses they hope will help end a deadly pandemic that has so far killed more than 1.3 million people. Yeah, still misleading. The so far has killed more than 1.3 million people. The way they measure death is if you've got a positive COVID-19 case within 28 days and you die, then that's COVID-19. I wonder how that 1.3 million stacks up historically against the flu numbers. The flu's disappeared, right? Completely gone. So I wonder what the last 5 years of flu numbers look like when you compare them to the 1.3 million people who have died for COVID-19. I wonder if that maps pretty well. Anyway, so far, Canada has secured the 414 million vaccine doses, more than 10 doses per capita for a country of 37.9 million people. This number would be enough to vaccinate Canada's entire population, quote, 5 times over, beating out every other country in terms of confirmed orders for COVID-19 vaccine per capita, according to data analysis compiled by Duke University. Why are we buying so much? And okay, well, it explains it here a little bit. There are reasons for this. None of these vaccine candidates have been formally approved yet. It doesn't exist yet. And Public Services and Procurement Canada told Global News that all of the vaccine candidate agreements Canada has secured are 2-dose vaccines, with the exception of the Johnson & Johnson candidate, which is a 1-dose vaccine. Canada has reached agreements with 7 different companies on track to produce the world's first COVID-19 vaccine, the Prime Minister said in a press release at the end of October. Okay, so this is why I think that we have 10 doses. It's like you buy this dose and this dose and this dose. And if this one's 2 and this one's 2 and this one's 1, that's five doses per person, right? And to hedge your bets, you buy this one and this one and this one, and that's 2, 2, 2, right? So there's your roughly 10. I think that's 11, but whatever, it doesn't matter. That's why I think we've got so many doses per capita. But do I think that that's the right move? No. I mean, point me to a successful SARS vaccine. There wasn't one. Or a MERS vaccine. There wasn't one. Or a flu vaccine that doesn't need to be changed a lot every single year, right? And aren't the flu vaccine and the COVID vaccine, or the flu virus and the COVID virus similar? Aren't they really similar? Couldn't it just be a mutation of the flu? I'm speculating. I don't know. I've heard that people we're talking about how in the testing, the flu vaccine or the flu and COVID-19 were so similar that they had a hard time distinguishing between the two. But I could be wrong on that. I don't know. Back to the article. Pfizer and BioNTech said their final results Wednesday proved their vaccine candidate to be 95% effective in preventing COVID-19, while Moderna's preliminary data from an outgoing study said its vaccine candidate was 94.5% effective. So the 95% effective is preventing the actual vaccine. But like, isn't the goal just to live? Isn't the goal just to survive the vaccine? Here's the CDC survival rates. And the CDC survival rates are, if you're 0 to 19, well, it's 99% until you get to 70 plus years. And then it drops down to 94.6%. It is deadly. There's certainly something to be careful of. Right? It's not something to be taken lightly, but at the same time, it's certainly not something to shut down our entire economy over in fear. Here's Rocco Galati, and he says, #1 paper by readership in the UK accuses the government of lying. And it says, critical care bed occupancy rates versus 5-year average. And the blue is the 5-year average, and the yellow is the 2020. And that's as of November 8th, and we're the 23rd. So all of them are well below capacity. They're at like 75%, right? 75%-ish. So that's interesting. Same thing is happening in Ontario as well. Here's the Sun article, and I wanted to show you this. This is the hospital bed occupancy 5-year average as well, right? Like you've got the yellow is the 5-year average, and the orange is the 2020 as of November 8th. That's notable, right? I like visual data like that. Do we have data like that? I think we do. I'd love to see some charts like that. Here's Ezra Levent again. He says, useful information from Alberta's pandemic stats, a chart of the comorbidities for people who died. Most had 3 or more underlying serious conditions. The average victim was in their 80s and already had hypertension and dementia and heart disease. And not to say that anybody deserves to die, but we all die. We all die. Every single one of us die. And eventually, something as benign as a cold, something as benign as a flu, something that you would have survived in your youth might take you. And that's awful. That's awful. That's terrible. But it is part of life. And shutting down the economy because elderly people are dying of a flu is probably not the best way to run humanity. It just probably isn't. I feel strongly that people should know this already, right? Anyway, hypertension, 87%. Dementia, 57%, cardiovascular, 56%, renal disease, 43%. So these are all the deaths, and all of them had some form of comorbidities, right? Like there's your percentages, but these people were going to die at some point, and probably soon, and maybe COVID accelerated it. And it's a darn shame that we have such a high death rate in Canada. I think that we could probably avoid that with better interventions and better treatments. But we're not using them, the right ones, the ones that have been talked about and silenced on social media. So, what are you going to do? The facts don't matter. The stats don't matter. They're locking down Newfoundland with nobody in the hospital and 20 odd cases, like 3 active cases, whatever it is. It's a ridiculous number to lock down Newfoundland. Really. Here's Robin Urbach. She's carrying water for this. We locked down everything in the first wave because we knew nothing about COVID-19 and had no idea. We're locking down everything in the second wave because of screw ups and incompetence. Blaming the public. Robin, what about all those flights that keep landing, right? What about all of that? And she's talking to Dan Kelly, the CFIB guy that I was telling you guys about. And somebody responds, seems to me like an assault on the public and small business. This is one smart virus knows the difference between a small local business and Walmart. I can't believe people believe this. And here's Professor John. Oh, I'm not going to try that. He says, quote, if we had not known about a new virus out there and not checked individuals with PCR tests, the number of total deaths due to influenza-like illness would not seem unusual this year. So, not to say that every death isn't a tragedy and that it's a shame that COVID-19 is accelerating elderly people to pass away. But my goodness, there's a better option than locking down the entire country. And there should be a better option offered from all levels of politicians than locking down the country at this point in this pandemic, okay? Really should be. Why are we not demanding it? We should be demanding it. Here's Bernie's tweets. Men are 5 times more likely to die from cancer than COVID. Women are 7.5 times more likely to die from cancer than COVID. Yet 350,000 lost cancer referrals, 62,000 lost urgent cancer referrals, 12,000 lost secondary cancer treatment appointments. Why do only COVID deaths count? I think this is American, as Bernie is not Bernier. But I'm just making the point that we've got a health system that's being held underwater, and we're we're using excuses to shut down surgeries. There have been reports of sick kids in sick kids hospital that missed life-altering windows to fix like cleft palates and things that are going to impact them for the rest of their lives. Like, we could fix this, but we can't if we can't get them into the operating room. And it just seems like, again, this is a poor excuse to, and it's the cure-all excuse, right? COVID. We can't possibly do it because of COVID. Can't go there, might die of COVID, right? It's like, well, my goodness. Here is HBC. If the lockdown prevents HBC from earning revenue, how precisely will they pay rent? Dark days. Hudson Bay has stopped paying its rent at malls across the country. Is it in trouble? That's a bad indication, right? That's a bad indication. It's tough to pay rent when people don't go shopping. And when the government is telling you clearly, stay home, stay home, stay home, shop from home. The only way to stay safe is shop from home. Yeah, this is going to happen. This is going to be an absolute rout. And you know who's going to pick it up on pennies on the dollar? People with money. And you know what? Who's not locking down? Wuhan, China. They're not locked down at all. Business is normal. Very interesting, right? Conrad Black says Trudeau's reset aims to revisit the failed policies of yesteryear. Why is our leader putting us to sleep with sophomoric bunk about recessing backwards into lobotomist socialism and pseudo-environmental self-impoverishment? That's a lot of big words, but I agree with them. Why are we purposely cutting off our foot, right? Angrily cutting off our foot to gain nothing for safety, right? To shut down our economy. We'll walk around without Alberta, right? We'll take off that foot, and it's going to be better for everybody. I can't tell you why or explain it, but it is. Sure, Justin, I don't believe you. Into further spending and monetary news from Canada's government. Canada Infrastructure Bank has received $35 billion, but completed 0 projects since establishment in 2017. Minister Catherine McKenna says the bank absolutely does need to deliver. Yeah, I guess so, eh? I mean, yeah. Here is Chrystia Freeland. She won't explain how $203 million in small business loans went for public administration when the rules say the government can't lend to itself. So how did that happen? And she just flips her hair and gives that look, and that's all she needs to do, right? Minister of Finance, everyone. Deputy Prime Minister, next Prime Minister of Canada until, snap election. Who am I kidding? We're not going to get an election. If we do, it'll be run by Dominion. Back to this. Aaron Werdick, Minister Guilbeault should rethink his bill and back off his misguided plan to force Canadians to pay more for content they want in order to subsidize content they don't. I don't like Mr. Guilbeault. I think that he's a bad pick for a minister. I think that his plan is a wolf in sheep's clothing. I think they say it's meant to do one thing, and when it's implemented, they'll use it to do another. And I don't trust him. I don't trust the entire cabinet. I don't trust any of them. None of them. Slimy Lametti. No, I don't trust them. I don't trust any of them. Here's Max Bernier. He says, most effeminate boys and tomboys grow up to become healthy gays and lesbians or heterosexual adults. Bill C-6 will encourage them to think they are the opposite sex and to destroy their body. It's regressive, disgusting child abuse. Very concerning. Bill C-6 has been something. So I try and pick up a story and then follow it along. Like if a bill's being pushed or something like that, and follow it along the way. I've been watching Bill C-6, and not that I didn't understand the width and breadth of it, but they're pushing it like it is they're banning conversion therapy. But what they're banning is any encouragement that like gender dysphoria is a thing, or saying that like you are the gender that you are, and learning to love yourself and blah, 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 all that stuff. That's what's illegal now. Isn't that interesting, right? So it's very, it's very, very dangerous what these liberals are doing. There are so many fronts. There are so many things that they're getting wrong. It can't be accidental, right? It's like when you walk in and you see that your kids have destroyed the whole room. It wasn't an accident. They may have not been paying attention, but it wasn't an accident. That's a bad example, but all of the bills that they're pushing, all of the things that the liberals are focusing on, all of the things that they're choosing to spend their time on passing bills, like Bill C-6, they're framing it one way to sell it to the public, and in actuality, what it does is damaging, and it flies in the face of Canadian tradition. Like, we wouldn't hurt our kids like that. We wouldn't hurt our kids like that. We would try and help our kids. And if you look at the statistics for transitioning, etc., it often doesn't help the person's mental health state. It doesn't help the situation at all. All it does is add another another bit of maintenance that they need to actually follow through with if they're to remain healthy. But it doesn't meaningfully, they don't wake up years later and say, I'm so glad I did that oftentimes, right? And I'm not trying to paint everyone with the same brush. I'm sure there are situations where people do wake up years later and say, man, that was the best choice ever. But I've seen videos of people who regret what they've done, and it's not reversible. You can't go back, right? So once you've done that, and having the government, it's one thing to have the government be 6 feet away from it and say, medical professionals, and that's between you and your doctor, blah, 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 blah. But having the government say, having the conversation of, maybe this is a mental health issue, maybe you should stay biologically who you are and what you are, et cetera, that's illegal. And that's a step too far. That's the same as compelling speech, right? A step too far. You can't have specific conversations with specific people about specific things, right? It's very so scary. On to funny news, I didn't see this in any of the Toronto newspapers. If anybody's seen this, if anybody's got a link about this, I'd love to see a Toronto newspaper. Everybody basically said Teenage Mutant Ninja Turtles are confirmed. I don't know where this is or what happened, but the Daily Mail US is saying huge sinkhole with a glowing green liquid oozing out is found on a Toronto street. So if you've seen this, if you're in Toronto and seen this, I would love. Did they color that? Like, did they make that up, or is that teenage secret of the ooze? It's not so secret anymore. So the Sidney Powell stuff. Sidney Powell is not part of Trump's legal team. There was this big announcement the other day, yesterday afternoon. Trump's legal team basically said Sidney Powell it doesn't work for us. She's an independent person bringing her own lawsuit. And a lot of people were like, oh my goodness, this is the worst news ever. Like, why did they split with Sidney Powell? Blah, 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 blah. Sidney Powell is acting on a different person's behalf. So like Trump's legal team is forwarding his legal stuff. I think Sidney Powell is working with the Trump team to forward like the American people's interest in that case, right? She's representing the American people, not Trump. As far as I understand it, from what I can read into it, and I'll post some pictures. I tweeted the pictures out, just talking about some discussion about the strategy of this. And basically it's Sidney Powell can say things that the Trump campaign can't say, or the Trump team can't say, and they don't want the judge conflating that as being from the Trump team. So I don't know what that means, but if you're interested in the evidence for the voter fraud, here's a compiled list, and it seems like there's a lot of evidence of voter fraud. Like I've said, they've got a lot of time. Trump's got time. December is a little while away. This whole week is, we're not even in December until next week. So this whole week is Thanksgiving. Most people aren't paying attention to politics. It'll be in the courts, and Trump's filing his lawsuits today, as far as I understand. Part of Trump's legal team is appealing some state dismissals. I still think, and there's a lot of people who are saying it's over, Biden's got this, no problems, everything's, but I don't see anything has meaningfully changed since last week. They're still counting. There's still legal challenges. The counts are Giuliani spelled it out. He said we need an audit. The recounts are going to garner the same result because the illegal ballots are going to be counted as true. So they're going to go for the audit. And Trump says in his Twitter feed that he seems confident, we'll put it that way, about flipping 4 states, which is easily enough to win the election over Biden. And he says, he being Trump again, or from what I saw, 6 states were in play, right? So if 4 go to Trump, I can't imagine if they prove enough for the 4 to go to Trump, I can't imagine that they'll need to prove the other 2, but they probably will, right? If it's true in 4 of the states, do you think that it would possibly be true in the other contested states? I think so. And I think that there's a lot of evidence here. Now, I've said before, this is a war, right? And you can have a plan to take a city and move through the city, and something crazy happens, and it takes a lot longer than you imagined to do what you were going to do. And that's out of your control, right? It takes longer to take the bridge. It takes longer to take the city center. It takes longer to do whatever you're going to do. And so
the post-apocalyptic fiction section has been moved to current affairs.
Goodness. I got a phone call.
Please note. Yesterday I was talking about...
I got a phone call and paused things, and then this tab opened up.
The New York Times is almost
unbelievable. Anyway, it takes longer to do what you're going to do. So the fact that people are trying to call this and say, oh, it's all done, Biden's won and Trump's lost, I don't think so. I think that there's a whole bunch more left to go before we see the winner of this. And I think it's going to be some legal bombshells, and I think that they're going to be happening this week. But who knows? It's a war, right? It's a war. So could he lose? Sure, he could lose, possibly. I mean, I think that if he loses, we'll see some more fireworks. But I think that we're far away from that point at this point, right? I think that the media and there are pundits who want you to move on, but nothing has meaningfully changed. There's legal challenges, et cetera. I think this is going right to the Supreme Court. I saw the SCOTUS blog thing. Oh, the Supreme Court's not taking this up. I don't think that the Supreme Court can take this up right now. I don't think they can say, yeah, we're gonna take that. I think that it has to go through processes, right? Like this happens and this happens and this happens. It's like taking it over somebody's head, right? They say, well, great. Have you talked to the teacher? Go talk to the teacher first, and then we'll talk to me. So it's the process, right? And the Supreme Court, yes, this is a big deal. And do I think that the Supreme Court should get involved? I think that they should get involved. But I think that there are procedures that govern what's happening. I think that there are a lot of people who think that the procedures will be enough to overturn the election and the Supreme Court may not have to get involved at all. And I've heard that kind of speculation from conversations in Twitter threads from Trump team lawyers and Sidney Powell, et cetera. Lynn Wood, I think, was the thread that I was reading that through, that he was speculating that they wouldn't need the Supreme Court, that once they showed their evidence that it would be obvious. But who knows? I don't know. But if you're interested in the evidence, there's the evidence. It's a huge database of voter fraud evidence, all sourced. Very interesting stuff. Videos and all of that stuff. People shredding ballots thrown out, blah, 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 blah. If you extrapolate this, it's unbelievable that there aren't more people who are questioning the other elections across the West, right? Where's the accountability for Dominion? Where's the accountability for all of the other stinky stuff? Faith Goldie, right? Like, how did that mayoral race happen and nobody care that the CRTC rules were ignored with regards to election campaign ads, right? Bell and Rogers were like, oh, that might damage our reputation. And then CRTC was like, oh, they're right. That might, yeah, okay. Thanks, guys. Bye. Have a good day. That's it. Like, that's enough, right? That's enough. Oh, they're terrible. You can't have them. Unreal what's going on in our country. And it's going to continue until a bunch of businesses stand up and say, fine every single one of us, Doug Ford, and we're going to clog your entire court system and you're not going to be able to do it. And that's how I think we get out of this. But it seems like the will for that needs to be everywhere. Everybody needs to say it. Everybody needs to do it. And I'm not seeing that, so we'll see what happens. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. I should be recording tomorrow with Greg. And have a wonderful